Hi, I'm Val Rogers, and I'm a nurse researcher who cares about sleep and sleep disorders in children, particularly now children with cancer. Right now I'm studying adolescents who have completed their cancer therapy, and we're looking at whether their circadian rhythms have been disrupted by that cancer therapy compared to children or adolescents who never had cancer. And then a second part of our research is looking at if they have disrupted circadian rhythms, what do we do about it? It's not something you can fix with medications. The reason that we're looking at this to begin with is because there have been some studies in adult cancer patients where they have found not only are their circadian rhythms dysregulated, but the patients who have dysregulated circadian rhythms have poorer quality of life, they have greater fatigue, they aren't as responsive to their chemotherapy, they relapse more quickly, and they die sooner. So for the first part of the study, the first aim, we're basically having adolescents wear something called an actigraph. It's kind of like a Fitbit. It measures their activity through the day and night, and we can tell a lot by that in terms of how regulated their circadian patterns are. As a second part of the study, we are looking at an intervention called bright light therapy. And the reason that it's effective is because a light box can take the place of the sun, which is the most powerful setter of our circadian rhythms. So we hope that we can translate that to adolescents with cancer to see if we can improve or keep their circadian rhythms from dysregulating during treatment. There are a lot of things involved in cancer treatment. There are drugs, there are surgery, there is radiation, but all of these things produce side effects that we have had a very hard time learning how to manage. So I think the new knowledge that we're going to produce is ways to manage those symptoms. So I think this involves some fairly easy modalities for them to use that don't involve using drugs, which they have used enough of in their life. Nurses aren't looking at the cure. They're looking for ways to make that cancer livable. We have to do the research to show that these things are effective in helping improve the quality of life, the health, and the outcomes of these children across time.